According to the Centers for Disease Control and Prevention, concussions have become a public health concern. In Hawaii, there are approximately 1,000 concussions reported every year in high school athletics. The purpose of this video is to provide concussion education and awareness to coaches. As a coach, you should know Hawaii's concussion law, signs and symptoms of a concussion, what to do if a concussion occurs, what are the criteria for an athlete to return back to play. Every state in the U.S. has a concussion law. In Hawaii, the concussion law requires mandatory removal from play when a concussion is suspected. Concussed athletes are required to have a physician clearance to begin participating in practice and games. An annual concussion education awareness is mandatory for parents, coaches, sports officials, and school staff. As a coach, you are responsible for removing an athlete from play when a concussion is suspected. You do not need to know for sure that the athlete has a concussion, but if you think, feel, or suspect that the athlete is showing symptoms of a concussion, that athlete should be removed and you as a coach should refer to your athletic trainer or physician. It is better to be cautious and sit them out. As a coach, you are responsible for making sure the athlete has a written medical clearance from a licensed healthcare professional prior to being allowed to progress to the return to play protocol. As a coach, you are responsible for making sure the athlete is gradually returned back to play. It's not wise to let an athlete recovering from a concussion to start full contact practice as soon as they are released from their doctor. Work and communicate with your athletic trainer if one is available. During this video, we will discuss the gradual return to play process in more detail. A concussion is a type of brain injury. Dr. Jennifer King explains what exactly a concussion is.
A concussion basically is a brain injury, and actually in Latin it means to shake violently. So what happens with the concussion is that there's enough force to the body or to the head that causes the brain to shake inside the skull, and when that happens, all the chemicals that normally regulate the entire body go off balance.
Here are some important things to remember. You don't have to get hit in the head to sustain a concussion. Blows to the body send impulse forces to the head, like a whiplash motion. That causes the head to move violently and may cause a concussion. Medical imaging such as CT scans, MRI, and X-rays will not diagnose a concussion because a concussion is not a structural injury. A concussion is a metabolic functional injury. Concussed athletes will describe their symptoms differently, and no two concussions are alike. A key to protecting our athlete is being able to recognize the signs and symptoms of a concussion. The signs and symptoms of a concussion can either be observed by a coach, parent, or reported by the athlete.
When we are covering a game on the field, the things that we look for on the athletes is based on, one, the hit itself. So if we're lucky enough for either the coach, the athletic trainer, or the physician to see the hit, then sometimes that can make us worry that the athlete sustained a concussion. If they complain of symptoms, then it makes it a little bit easier because then you can kind of look at all the symptoms they're having and correlate it with the hit that they had. But then also just watching them how they return to play. So are they slow to get up after they get a hit? Are they able to maintain their balance? Do they remember their plays? Are their friends telling us that they're complaining about symptoms? So those are the things that we look for on the field.
So they're holding their head. When an athlete's body appears to go limp or crumbles immediately after a hit and they don't move. When an athlete gets up and staggers around clumsily. When an athlete is very slow to respond to my questions. If I observe any of these signs, the athlete is removed immediately and he or she would be assessed on the sidelines and managed appropriately. Sideline assessment would include symptom monitoring, balance assessment, questions to assess orientation and concentration. We'd also do some special tests such as vestibular ocular motor screening, or VOMS, to assess visual function and reflexes.
Coaches need to learn to suspect when concussions may be present just by observing the injury itself. If someone takes a particularly hard hit, they're really slow to get up. They need to be aware of their athlete's normal behavior. So if an athlete starts behaving differently in the course of a game, maybe after an observed collision injury, or maybe it was a collision that they didn't see or that looked fairly routine or normal, but the athlete comes back and starts reporting that they don't feel quite right, they're having trouble focusing, they may have a headache, they may feel dizzy. It may be a teammate that says, I'm not sure if this particular teammate is doing well. Coaches just need to be aware that these things might happen and have a low threshold for saying, you know what, it's better to pull you out and and get this checked out, keep you safe, and return you back to the next game than potentially take the risk of worse injury or missing the rest of the season because of a concussion.
Some of the commonly reported symptoms an athlete may report to a coach or parent are headaches, difficulty concentrating, fatigue, drowsiness, or dizziness. It's also important to know that throughout recovery, symptoms change and vary. For example, during the early stages, right after injury, the concussed athlete may complain primarily of a headache, dizziness, and fatigue. A few days later, maybe after 4 or 5 days, symptoms may become more cognitive, like difficulty concentrating, difficulty remembering, and anxiousness. No concussions are alike, and everyone's concussion symptoms and recovery times will vary. Coaches know their athletes best. When a coach suspects a concussion, it is important to know what their role is. If an athletic trainer or medical personnel is on the sidelines, coaches should immediately notify them and let them manage the situation. If no athletic trainer or medical personnel is available, coaches need to monitor the concussed athlete and decide if the athlete can move off the field safely under their own power, or to call 911.
State law requires that any individual suspected of having a concussion must be removed from play and may not return until evaluated by a licensed healthcare provider, such as a registered nurse, licensed or registered athletic trainer, neuropsychologist, physician assistant, physician, osteopathic physician, or physical therapist trained in the management of sports concussion. It is the coach's responsibility to recognize an athlete with a suspected concussion and to remove that athlete from play until seen by a licensed healthcare provider. When a suspected concussion occurs and an athletic trainer or medical staff is present and on site, it is then the coach's responsibility to contact the athletic trainer or medical staff immediately. If the athlete is on the ground, do not touch or move the athlete. You must call the athletic trainer or medical personnel and monitor them until help arrives. If the athlete is already off of the field or moving off of the field, take them to a quiet or less crowded area of the sideline and contact the athletic trainer and monitor the athlete. Do not leave the athlete alone. If there are no athletic trainer or medical personnel present, then the coach's responsibility and actions will depend on the condition of the athlete with the concussion. If the athlete is unconscious, seizing, tonic posturing, or unwilling to move, do not touch or move the athlete. Instead, activate the emergency action plan and call 911. Monitor the athlete until emergency medical system arrives. The only time a coach should touch an athlete with a suspected concussion is if he or she is not breathing or has no pulse and compression-only CPR, AED, or rescue breathing need to be administered. In the scenario that there is no athletic trainer or medical staff present, and the athlete is able to move off of the field under their own power or able to move without problems, take the athlete to the sidelines, preferably in a quiet area.
It is very important that coaches never leave the concussed athlete alone. Always have the athlete monitored by an assistant coach or a responsible adult. The CRT-5 is a simple tool coaches can use to monitor athletes. Coaches, make sure parents are notified about the concussion and that they notify the school's counselor. Coaches provide parents with information about the injury event, observe signs and symptoms, in order for parents to relay this information to their physician. Do not let athletes drive or walk home alone. Coaches and parents need to understand that continuing to play can have short-term, long-term, and possible catastrophic outcomes. Some of the evidence-based research that demonstrates the dangers of continuing to play with a concussion are: a concussed athlete who continues to play is at an exponentially greater risk for long-term or catastrophic brain injury. A concussed athlete who continues to play with a concussion will prolong the recovery and create a more complicated recovery. A concussed athlete is more prone to lower extremity musculoskeletal injury. A concussed athlete's athletic performance will decrease. Concussion law's aim is to protect concussed athletes from potential catastrophic events. Every law in the U.S. mandates that an athlete with a suspected concussion be immediately removed from participation until cleared by a physician.
Second impact syndrome is somewhat of a controversial diagnosis, but essentially it's a brain injury that you sustain after already sustaining another brain injury that you're not yet fully recovered from. The danger is it causes a catastrophic swelling of the brain. And it's one of the main reasons why we're so careful about making sure someone's completely over their concussion, which is a kind of brain injury, before sending them back out where they could sustain another blow. So it's thought in second impact syndrome that when the brain sustains a second injury while it's still recovering from another, that the brain loses its normal ability to quote-unquote auto-regulate the blood flow that comes in and how much pressure is inside the brain. And over a really short period of time, it can be seconds to minutes, the brain can sustain significant swelling inside the skull and cause catastrophic injury.
It is important to recognize when to call 911. Emergency situations can occur on the field or on the sidelines. During a concussion, some of the red flags of when to call 911 are loss of or fluctuating levels of consciousness, increasing confusion, increased irritability, numbness in arms, bodies, or legs, pupils appear unequal in size, repeated vomiting, seizures, slurred speech or inability to speak, inability to recognize people or places, or a worsening headache. Coaches, if you observe loss of consciousness, seizures, or neck pain, do not hesitate to call 911 immediately. Coaches need to be aware that the Hawaii concussion law requires that a high school student athlete may start a return-to-play protocol when the athlete is cleared by a physician. A gradual return-to-play protocol ensures that the athlete is gradually progressed back into the sport and contact. Important points to remember. To begin return-to-play protocol, the concussed athlete must be cleared by a physician. Each step of the protocol is divided up into 24-hour periods. Work with your athletic trainer on the gradual return-to-play protocol, and if you need more information on this, go to hawaiiconcussion.com. Concussions can occur in any sport. Researchers are finding ways to reduce the risk of concussions, but what can coaches do now? It starts with concussion education, awareness, and encouraging athletes to report any suspected concussions.
I didn't want to report my concussion mainly because I wanted to keep playing football. I didn't want to lose my starting spot, or I just felt like, you know, this is like minor, this is nothing. Like, people have injuries all the time, you know, and they just play through them and it'll eventually just get better, but that just wasn't the case. If I had a chance to do things differently, I would take it seriously, because knowing that, you know, at this time, football may seem like it's life, you know, football may seem so important, but looking down the road, like, I have to realize that football isn't life. Like, there's more to life than football, and you only have one brain and one head. Take it seriously and really kind of, I guess, realize like the consequences of having a concussion or how it could affect you long term. So yeah, I take it seriously and really work and try to get better.
It is important that coaches realize they can have a significant impact on their players' safety, health, and well-being. We ask coaches to discuss and encourage their athletes that they take care of themselves and their teammates, and don't be afraid to report their concussions or concussion-like symptoms. We thank you for your time and your commitment to the development of our youth. If you would like more information on concussions, please visit hawaiiconcussion.com.